Dear all, Namaste. In this video, I will be discussing about orbital complications of sinusitis. The orbital complications are the commonest complications of sinusitis, and young people are at high risk because it is due to ethmoidal complex infection most of the times. Around 85% of orbital complications are found in less than 20 years of age because of pneumatization of the ethmoid and immature ethmoid complex, because orbital complications usually go through the ethmoid and less from the maxillary sinus. The left orbit is more commonly involved than the right. The causes are usually unknown, but most of the times, many of the congenital anomalies occur on the left side. Therefore, it may be due to blockage of the osteomeatal complex that may add in inflammation of the sinus and secretions being accumulated there. Chandler et al. In 1970 classified the orbital complications of sinusitis as follows. They are pre-septal cellulitis, orbital cellulitis without abscess, orbital cellulitis with extra or subperiosteal abscess, orbital cellulitis with intraperiosteal abscess, and cavernous sinus thrombosis. This is the diagrammatic representation of the different complications. As you can see here, you have to look this photo very clearly and you have to understand it. This is the orbital septum. Orbital septum is the fibrous tissue or fibrous structure that separates the eyelids from the orbital cavity. So this is the important barrier. The maroon color represents the different infections. This is pre-septal cellulitis. You can see here, this is the orbital septum and this is pre-septal cellulitis. Okay, this is diffuse cellulitis with no abscesses, just cellulitis inflammation, and this is intraperiosteal abscess. Okay, intraperiosteal abscess. This is the periosteum, intraperiosteal abscess, and extraperiosteal abscess. Okay, this is the periosteum. This is just above, outside that, extraperiosteal and cavernous sinus thrombosis. Let's come to pre-septal cellulitis. As already told, pre-septal cellulitis is the inflammation which is external to the orbital septum that basically leads to edema of the eyelids, usually unilateral. When there is inflammation of frontal sinus, then there may be edema of the upper eyelid. Maxillary sinusitis, there may be edema of lower eyelid, and in ethmoid sinusitis, there will be edema of both the lids. But there is no tenderness, no visual loss, no limitations of the extraocular movement because the inflammation lies anterior to the orbital septum. As already told, orbital septum is the thick fibrous tissue that separates the lids from the orbital cavity. So the inflammation does not go beyond the eyelids. In this picture, you can see pre-septal cellulitis. There is inflammation of the upper and lower eyelids on the left side, and the orbit has become slightly smaller. The eye has become slightly smaller. This is due to swelling, but there is no problem with the movement of eyeball. So this picture depicts pre-septal cellulitis. Let's come to orbital cellulitis without abscess. Now, the infection goes beyond the orbital septum to the orbit, that is orbital cavity, but there will be simple cellulitis, but no abscess formation. This is inflammation of adipose tissue deep to periorbital septum without suppuration. There will be diffuse periorbital edema with erythema will be there. There will be mild proptosis, but no restriction of extraocular movement and no change in vision. In this picture, you can see this is orbital cellulitis without abscess formation. The infection goes beyond the orbital septum, and this is the orbital cavity, and there is cellulitis. So this is the pre-septal cellulitis part, and this is the orbital cellulitis. Now, extraperiosteal abscess is the most common form of orbital cellulitis. Extraperiosteal, that is, the abscess is outside the periosteum, orbital periosteum. Localized extraperiosteal pus collection is there. There will be mild proptosis, restriction of the extraocular movement, and decreased vision. The color vision will be affected first. So the patient will see brown for red and black for blue. This is the periosteum, and the abscess is outside the periosteum. There is mild compression of the orbit. The orbital cavity becomes narrower, and there will be mild compression on the optic nerve leading to color blindness. Now let's come to orbital cellulitis with the intraperiosteal abscess. Now the infection goes to the intraperiosteal level. There will be mild chemosis, which is edema of the conjunctiva. There will be proptosis, severe asymmetric and quadrantic proptosis will be there. In frontal sinusitis, the patient will have downward and forward plus lateral bulges. And ethmoid sinusitis, there will be more lateral bulges. And in maxillary sinusitis, the patient may have upward bulge of the eyeball. Proptosis means forward bulging of the eyeball. The patient may have concurrent and complete ophthalmoplegia. The eye does not move properly, and there will be visual loss due to optic neuropathy due to compression of the optic nerve. This is intraperiosteal abscess. We can see here intraperiosteum. This is the periosteum, the intraperiosteal abscess, and it is compression on the optic nerve. Okay, the patient is having chemosis, swelling. Okay, and there is bulging of the eyeball. Okay, now coming to cavernous sinus thrombosis. When the cavernous sinus gets infected, the patient will have hectic fever and rapid onset of symptoms like bilateral orbital pain and severe chemosis. Till now, the patient had usually unilateral symptoms. Now, in cavernous sinus is the central portion, so patient will have bilateral symptoms. Bilateral absent pupillary reflex, bilateral symmetrical axial proptosis, and it will be sequential ophthalmoplegia starting from 6th, 3rd to 4th nerves. And patient may have papilledema and loss of vision, and patient may have painful paresthesia of the B1 segment of the 5th nerve. This is the cavernous sinus. Patient will have cavernous sinus thrombosis. We can see bilateral chemosis and proptosis more on the right side here. Orbital abscess is usually unilateral condition, as already told, and cavernous sinus thrombosis is always bilateral condition. Orbital abscess is slowly progressive, whereas cavernous sinus thrombosis is a rapidly progressive condition due to thrombus in the cavernous sinus. The patient presents with low-grade fever with mild chemosis and no paresthesia with concurrent ophthalmoplegia in cases of orbital abscess. Whereas the patient will have hectic fever, severe chemosis, paresthesia of the B1 B2 segment of 5th nerve with sequential ophthalmoplegia in cases of cavernous sinus thrombosis. And patient will have asymmetric quadrantic proptosis in cases of orbital abscess, whereas the patient will have cavernous sinus symmetric axial proptosis in cavernous sinus thrombosis. Thank you very much. Please subscribe my channel Dr. Krishna Koirala for more videos like this. Thank you.